Does your MRI report say you have a C5, C6 disc bulge? Are you suffering with neck or arm pain because of a C5, C6 disc bulge? Imagine living your life without the constant pain of a C5, C6 disc bulge. No surgery, no drugs, just a step-by-step method that targets the root cause of your discomforts and brings lasting relief. Now, if you're suffering from a C5, C6 disc bulge, I understand your frustration. You may have tried everything: physical therapy, painkillers, even considering surgery, and yet the pain persists. What if there was a better way? A method so unique and effective that it could finally bring the relief you've been searching for. Introducing the Back to Life method, a one-of-a-kind 5-step treatment protocol that combines non-surgical spinal decompression, advanced laser therapy, and personalized home care recommendations. This isn't just another temporary fix. It's a comprehensive plan designed to correct the cause of your C5, C6 disc bulge related pain and provide long-term relief. Refined over 24 years of clinical experience, the Back to Life method has transformed the lives of hundreds of patients. This method has been specifically crafted for those who suffer from a C5, C6 disc bulge and have yet to find a solution that works. It's not just managing symptoms, it's about correcting the underlying issue. By watching this video, you'll gain a complete understanding of our 5-step treatment protocol. I'll walk you through each stage so you know exactly what to expect and how this method will work for you. You'll understand the key steps to look for when seeking professional treatment, ensuring you ask the right questions and recognize if any critical elements are missing from your care. It's time to finally get your life back on track. And that's not all. Stay with me until the end of the video and you'll receive a free copy of my book, Back to Life. Imagine getting your life back while getting your health back. This book is packed with more valuable insights, tips about back care, and the Back to Life method. Hi, I'm Dr. Raminder Burke, a chiropractor in Woodbridge, Ontario, Canada. We've helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degenerations, lumbar stenosis, sciatica, and radiculopathies. We use non-surgical decompression as the cornerstone of our unique and proven Back to Life method. Be sure to hit that subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back and leg pain. Plus, you will discover which therapies are best for treating disc bulges, disc herniations, and other spinal degenerative conditions. I'll upload a new video every week. Now, before I dive into the 5-step treatment protocol for the non-surgical spinal management of a C5, C6 disc bulge, let me first explain what a C5, C6 disc bulge is, why it causes such intense pain and disability, and the common symptoms associated with it. So what is a C5, C6 disc problem? It's basically as this disc is sitting between two vertebrae, an alignment problem called subluxation, a misalignment from countless reasons in life, causes a bad alignment means lack of movement. And that lack of movement around the cartilage, which needs that movement for fluid exchange and for that disc height, is now locked and compressing on that tissue. So as this disc starts getting compressed, we start seeing an initial problem developing of a C5, C6 disc bulge, which only advances with time without the proper corrective care. So what this condition is going to do to your spinal cord and your nerves that come out of here is, of course, in many ways, this can pressure these nerves, your nervous system in this area, and the associated feelings. So if it's going to push into the nerve on the left side or the right side, or directly on the spinal cord itself, the symptoms are going to mirror that compressed disc, causing pressure on nerves and spinal cord. Now, over time, these spinal misalignments, these compressed discs and tissues are going to lead to arthritic changes, right? So the degeneration that this leads to eventually, as the disc material decays further and further, the bones have to compensate. As these bones compensate, the body's going to lay down further bone to strengthen that area, but unfortunately, that's degeneration. That's an arthritis that would develop around these nerve roots, which is going to become more permanent and irreversible as it progresses over time. So what is someone going to feel with a C5, C6 disc bulge? Of course, it's related pains in that local area, whether it's in the neck itself, whether it's going to go up and cause headaches, sinus, jaw, neck pain up here, below neck pain that travels and radiates first into the traps, into the shoulders, restricted ranges of motion. Now we're getting disability in the shoulder. We're getting pain in the arms and hands eventually, numbness, tingling, and that means weakness and degeneration further in our abilities, our function, our sleep, you name it. It all comes from an eventual problem that's resulted by the C5, C6 disc bulge. So getting that corrected is going to reverse these pains and prevent them from getting worse. As you can see, the pain and disabilities caused by the C5, C6 disc bulge involve a complex set of conditions, all which must be accurately diagnosed and targeted during treatment. This is why a multimodal approach using multiple types of treatments within a comprehensive care program is essential for successfully treating the C5, C6 disc bulge. This approach not only provides immediate pain relief, but also ensures long-term correction and stabilization. That's precisely why the Back to Life method is designed to achieve. The Back to Life method we're going to get into next consists of 5 distinct steps that work synergistically to deliver optimal results. So the first out of the 5 steps is yours. The first step we need you to do is go ahead and book your appointment, the consultation, book it through our online portal. Get in and make the changes that you're looking for in your life. We know that you've been skeptical and hesitant and don't know where to go, but we're going to make this real easy for you. Now, step 2 is going to be one of our lovely staff is going to be calling you back to take the initial history and information that we need to put together your past, your current situation and lifestyle that's causing these discomforts and pain. By calling you back, we're going to give you all the information you need as well to go for your digital x-rays, so we have everything we need when it comes to your initial in-office visit. Now that you've done the x-rays and we've got everything we need to put together the key understanding of your condition, this is when we meet with the patient in office. We have all the history from your consultation. I have reviewed the digital x-rays, and I'm going to be showing the patient her actual x-rays. We're not just telling you what's wrong with you. We're not just telling you to take our word for it. We want you to see your C5, C6 disc bulge in an actual x-ray and understand the level of degeneration that you have specific for you. Degeneration can mean a wide variety of levels, and we want you to know at what level you are. So when you understand that, then you'll understand the reason for the comprehensive care plan that comes from that. The recommendations are always unique to each patient. The care plan that we put together can vary from a few months to a year because we need to understand this condition can be chronic more than in some than in others. So that care plan is laid out week by week, month by month with specific checkpoints. We increase specific treatments along the way. We also give you home care recommendations that are added at certain points, and then even x-rays are done afterwards to confirm the changes from the first x-ray towards the end of this first part of your treatment. So always there are steps along the way to make sure that you're progressing well, you're getting the results that you're looking for, and then we're ongoing from there into maintenance care to keep it from coming back. So next, as we get through the care plan recommendations, we begin treatment right away so we can get you back to life. So we're going to step outside and show the actual steps that are taken during the Back to Life method. Now, as the patient actually begins care for the Back to Life method, it's, as mentioned, a multimodal treatment approach. We're using various therapies that have been figured out over 24 years of clinical experience, using alignment through chiropractic, using laser therapies to break down inflammation and sorenesses, and the keystone of this treatment, this spinal decompression table. It's a 3D spinal decompression with true programmed decompression that over a series of pulls and relaxations is going to create a long-term disc relief and correction of the problem at the C5, C6 level by pulling, relaxing the spinal nerves, and helping this problem get corrected before it advances into permanent. So this is part of the treatment with other home therapies, stretches and recommendations, Deneroll neck orthotics in reversing curve problems, and correction of the cause and long-term maintenance. Patients continue to get relief and get back to life. As you can see, the Back to Life method is a comprehensive, non-surgical approach to treating C5, C6 disc bulges. Developed over 24 years of clinical experience, this method consists of 5 distinct steps that work together to target the root cause of pain, providing both immediate relief and long-term correction. By understanding these key steps, you'll be empowered to seek the right professional treatment and ask the critical questions necessary for your care. With the Back to Life method, you can finally experience lasting relief and reclaim your life. Now I want to hear from you. What has been your struggle with C5, C6 disc bulge? What did your MRI report say? What treatment have you done? What has worked for you and what has not worked for you? Share your story in the comments below. I would love to hear from you. If you found this video helpful, please hit that like button, subscribe to my channel, and share it with others who might benefit. As promised, I have a free gift for you, a copy of my book, Back to Life. Imagine getting your life back while getting your health back. You can get a free copy from the link in the pinned comments below. I have an amazing video suggestion for you to watch next. Go watch this one here, where I give you a complete C5, C6 disc bulge exercises following along this routine. Go watch this video now.